Surgery. It's a word that patients hate hearing and one that keeps many away from the doctor's offices. But there are ways to treat back pain without going under the knife. Dr. Rodolfo Gari from Florida Pain Relief Group is back to talk about one of those ways today, spinal cord stimulation. Okay, Dr. Gari, great to have you back.
Pleasure.
What is spinal cord stimulation?
Certainly. So actually, spinal cord stimulation is a technique where we place these tiny little electrodes into the back of your spine that helps, it blocks the pain levels. It's actually based on a Nobel Prize winning technique. So if you think about it, when you were a little kid and you placed your finger on the stove and it hurt, and mom came and rubbed it and it felt better. Well, the reason why it felt better is because the touch sensation actually went up to your brain and blocked the pain going to your brain.
Interesting.
What spinal cord stimulation does is these tiny little electrodes, they're no more than epidurals. So when the ladies have the little epidural catheters for labor, it's the same thing, but but we place these little electrodes there, and what it does is it replaces the back pain and the pain going down to the legs with a very gentle tingling sensation. So you feel a tingling sensation as opposed to having this constant back pain.
That sounds like a great thing for so many people. What kind of pain does it treat?
It treats basically back pain, low back pain. It treats any sort of nerve pain, diabetic neuropathy, any sort of a nerve entrapment. Patients that have had, we get a lot of patients that have had 2 or 3 or 4 back operations. There's nothing else that can be done. Those are very good candidates because, you know, they are constantly in pain. We can place that in there and get them some really significant relief, allow them to cut down on all these massive medications that they have to take just to live their everyday life.
Is this done through an outpatient kind of facility?
Outpatient procedure. You come in, we'll give you some sedatives to relax you, a little local anesthesia. It's done through a needle.
Okay.
We place those electrodes through a needle. And you go home the same day. Usually we do what's called a trial period, where we have you go home with it for about a week, make sure that it's going to work for you. If it works for you, we can get it implanted. It's a tiny little incision that just goes right down the skin. It has a little thing called a generator, which is the size of a $50, and the battery is rechargeable, so it lasts years.
Oh, so you don't have to keep going into the office to get this put in. You can have it put in, and then you're... Do you control it yourself, or...?
Yes, there's a lot of programs. So, for example, you say, well, you know, sometimes I get back pain, sometimes I have pain down the legs, sometimes a combination. Well, we can program this to have different types of variances. So, if you have back pain, you hit number 1. If you have leg pain, number 2, and so forth. Why
is this preferable to more traditional back treatments, like surgery?
Because a lot of times there are no other options. You have, for example, the chance of success after the first back operations is fairly high. The second one is not so high, and the third one, you're really talking maybe 15%. So after that, you're pretty much out of options when it comes to surgery. But you're not out of options when it comes to seeing us.
Okay.
Because we have a lot of different treatments.
Well, this is a great alternative to surgery in the first place, right?
Absolutely.
All right, Dr. Gari, thank you very much. Florida Pain Relief Group even schedules same-day appointments. Be sure to visit their website right now, floridapainreliefgroup.com, or give them a call, 844-KICK-PAIN. Dr. Rodolfo Gari, thank you again very much.
My pleasure.
We'll be right back.